Patient who has been on chronic glucocorticoid therapy with prednisone due to lupus experiences nausea, abdominal pain, and dizziness after a femur fracture surgery. Her blood pressure is 90 over 60 and pulse is 125. Compared to the normal physiologic response to surgery, this patient most likely has which of the following patterns of hypothalamic pituitary adrenal axis activity. Now, this patient is suffering from adrenal crisis due to the fact that she has been on a chronic glucocorticoid therapy that has suppressed her hypothalamic pituitary adrenal axis activity. Now, let's go over the hypothalamic pituitary adrenal axis. Now, in response to stress, the hypothalamus is going to be stimulated to produce CRH. Now, CRH is going to go down to the anterior pituitary to stimulate corticotroph cells to produce ACTH. And ACTH is then going to go down to the vaginal cortex, where it can then act on the zona fasciculata as well as the zona reticularis. And the function of zona fasciculata is going to be to secrete cortisol, which is a glucocorticoid. Now, in order to properly regulate this axis, cortisol is then going to inhibit further CRH as well as ACTH release. So this axis is tightly regulated. Now, if we are using glucocorticoids as a medication, cortisol can inhibit CRH as well as ACTH, which is then going to atrophy the sites of the neurons that produce CRH within the hypothalamus, as well as the corticotroph cells that produce ACTH. So, as a result, long term suppression of these areas can lead to adrenal crisis because we won't be able to produce cortisol when we need it in response to stress. So, this patient has been experiencing stress from the surgery and she needs cortisol in order to properly maintain her blood pressure because remember, glucocorticoids are going to regulate vascular tone by increasing norepinephrine as well as increasing renin-angiotensin, and it can also cause vasoconstriction. So this can help maintain blood pressure in response to stress. But if we don't have that activity, it can cause shock, which is what the patient is experiencing, and we call this adrenal crisis. So as we mentioned, the answer is going to be as for choice E, because corticotropin releasing hormone is going to be decreased, ACTH is going to be decreased, and cortisol is going to be decreased because of the suppression to the areas that produce CRH as well as ACTH. And as a result, in response to stress, we're not going to be able to produce cortisol due to that long-term suppression caused by her chronic glucocorticoid therapy